Another edition of our certificate program in natural medicine is here. You can ask around, what we promise is what we deliver. Most of our past participants are top flyers in the healthcare industry today. KEOBIK HEALTHCARE Academy has successfully graduated about 100 participants in several editions of our physically attended certificate programs. KEOBIK HEALTHCARE Academy has so far registered about 500 subscribers on our online masterclass courses in 19 countries and still counting. That is why we are obliging you to trust what we are offering you this time. Attend our certificate course in natural medicine that will be holding from the 20th to 25th of May, 2024. Venue, Lagos Chamber of Commerce and Industry LCCI. 2nd floor, number 10 Dr. NURUDEEN OLOWOPOPO Way, besides JAPAUL House, ALAUSA IKEJA, Lagos State, Nigeria. Time, 9 a.m. daily. Course fee, 100,000 Naira within Nigeria and $150 outside Nigeria. Our course content for the program includes nonlinear system analyzer, quantum resonance magnetic analyzer, medical laboratory science basics, basics of biochemistry, basics of human anatomy, lab report interpretations, therapeutic equipment like the meridian massager, cupping device, detox machine, etc. We also added naturopathic courses this time around that includes philosophies of naturopathy, plant taxonomy, nutritional medicine, birthing principles, plant harvesting, processing and storage, plant properties, plant formulations, plant tincture preparation, essential oil preparation, plants on high blood pressure, plants on ulcer, plants on infertility, plants on arthritis, plants on diabetes, massage therapy, and lots more. Seasoned lecturers with amazing knowledge and educational information that will shock, excite, and empower you have been packaged for this forthcoming program. Trust me on this. You cannot afford to miss this life-changing opportunity to be empowered. For inquiries, please contact 2348065605212. Thank you.
Which is called what? Resurrection plan. Yes, Bryophyllum pilatum. You can actually make one to resurrect. If one is in coma, you steam quickly in the steam and then squeeze it and drops of juice in the nostril of your conscious person. Pum, 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 pum. The person will sneeze and wake up. That is the power of resurrection plant.
So when I enter NLS, I just sit down in that biochemical analysis and I draw up most of my conclusions from it before I now enter all those pathology, all those things that you are looking at. It's easy for me to draw my analysis from the biochemical homeostasis, and that's what I want to teach you this morning.
Your body composition, your wellness and vitality, reproductive health, your tumor markers, and then possible complications, and then the things that genetics can bring up on you. Okay? Alright. So today I'm going to take us on something called biochemical markers. They are all integrated into this. So we'll look at hematology, we'll look at immunology, then we will do kidney function. So let's start with hematology. What is hematology? So hematology, you have, let's start with FBC, PCB, differential white blood cells, white blood count, platelet count, reticulocyte count. So you see, this is how it looks like, your biochemical markers. You remember this page?
C5, we look for C2. C1 is C2. We look for C3, this is C3. Third intercostal, that is 7th. Where are the writings? Is there C5? C5 is the, yes, C1. And finally, C6.
So this line is representing C6.
Yes, no, we said the heart's located and fall between the 4th intercostal space, 4th and 5th. Then we must start from 4th and 5th. The down, 4th and 5th, 6th, 7th, 8th, 9th, 10th intercostal spacings, because the heart is very close to the left side, and that is why all the probe is being arranged in the left side after the medial stimulus.
Okay.
Now, I want to explain something here. The line is called wavelength. We call it ECG wave. Now, this is, if you see something like this, you move like this. Are you seeing something?
Yeah.
Now, I want to now explain.
Some are faster than some.
Yes, good. So I want to use this, what I'm going to explain. Am I communicating? The first one here, the line here is, this one is P.
We handle the NLS, and I want us to do a quick review. This is very, very important. What are the 4 main factors you need to master for you to be good in NLS? Number 1, you need to know what?
You need to know the areas.
Jim, you need to use my word. You have to use my word, my slang.
Okay.
You need to know 4 main factors. There are 4 main things in NLS you need to know. Number 1, what is the new word? Social area or what?
The platform.
Know the platform.
Know the right platform. Right. So I'm saying these things there. If your NLS is open, it should start. This is what will help you master this thing. Just open up. There must be open select card. Pick a card. So I know which time.
That's why you understand.
No. No. Cancel. 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 I need you to get this. Let's do a recap of yesterday. We did cardiovascular and cerebrovascular data analysis, and we said that interpreting test result with the quantum analyzer is easy. You can just follow the words. Okay, you can even get a dictionary. Any grammar you don't understand, you just check it out in dictionary and apply it to the parameter you are seeing, and your problem is solved. Okay, so we are saying that cardiovascular and cerebrovascular is simply talking about analysis of what the heart and the brain. Okay, the heart and the brain, the heart and the cerebrum. Okay, and we also said that we need to have some knowledge of human anatomy to be able to understand the parameters. Alright, so some of these grammars, once you understand them, it will help you to figure out what an abnormal result looks like. Okay. So the highlight of yesterday's talk on cardiovascular, the first parameter we talked about blood viscosity, and we said that if the blood is too thick, then the result will be a moderately abnormal high, which can affect the flow. Alright, viscosity is talking about thickness of blood and stickiness of blood. Alright, another thing we talk about cholesterol crystal, and we said that cholesterol is used to make cells, it's used to make certain hormones, it's used to make bile. Okay, and we have the good cholesterol and we have the bad cholesterol. Right, and we said that the good cholesterol is the high density lipoprotein. We also said that the word lipoprotein is like a transport that transports minerals, oxygen, and vitamins and blood to the rest part of our body. Okay. Then we also said that the LDL is the bad cholesterol, which stores all excess cholesterol within the bloodstream. while the HDL is the good cholesterol, which takes away excess cholesterol from the bloodstream. Okay. Then we also said that cholesterol crystal is talking about the nature of cholesterol building up within the arteries. That when they are crystallized, they crystallize in a needle-like form, such that they can poke through the arteries, and when they poke through the arteries, they are going to cause a wound and will cause blood and everything to just pass through the blood vessel into the bloodstream and becomes a problem. Within a few minutes, the next reaction is going to be blood clotting. And when blood clotting takes place, it's going to cause a partial or total blockage of the arteries. And when that happens, then people begin to experience things like a stroke, especially when such is happening at the brain.
This is wet cupping.
If I were working on him, I'll have to check his blood pressure and everything. So also, depending on what you are hoping to achieve, you can use it on the acupoint or use it on where. If somebody comes and said, I have shoulder pains, you can just use it on the shoulder of the person. Yes, it can. You see that steam coming out already. No, you don't have to. So you can zip it up by yourself.
Okay, Anna, please, can you tell us what is happening here? Please, let's understand.
This is a sauna bath.
Okay.
What type of oil?
And essential oils. Or I use massage cream. Okay, I use massage creams. I just mix tea tree oil, eucalyptus oil. I have different blends of essential oils in here. Different blends of essential oil, tea tree, eucalyptus, whatever. Depending on if the massage or the cupping is basically for relaxation, then you use things like lavender. If it's for pain relief, then you use things like tea tree. So I've oiled his back. And so you look for the pain points. You look for the pain points. Maybe his pain points are here. Okay? So I go and put the cup on it and start to pop it. You can leave it for like 15 to 20 minutes. By the time you want to pull up, you will see that the point where he's having pain would have turned red. Okay, so what they always call bad blood is accumulation. That means blood is not flowing there, so there's deoxygenated blood in that place. Oxygen is not getting enough there. So those are the points you need to focus on. Okay, so we're starting. So there are different strokes. You want to start first with this. For those of us who know acupuncture, this line governing like that. So there's a line that goes from here like this. So